Cryptosporidium is a genus of 15 species of protozoa which cause cryptosporidiosis, an infection characterized by acute diarrhea, cramps, fever, vomiting, and weight loss. Once thought rare, we now know that infections are common, and the CDC estimates that 57,616 illnesses are caused by Cryptosporidium annually. It's especially troublesome because the spores are resistant to chemical disinfectants. This makes water supplies especially vulnerable to contamination. Risk factors for developing cryptosporidiosis are related to exposure to Cryptosporidium and include working at or attending a daycare, taking care of someone with cryptosporidiosis, traveling internationally, drinking unfiltered and untreated waters from sources such as rivers or lakes, swimming, farm work, and sexual contact with feces. Typically, Cryptosporidium enters the host through drinking water or contaminated food and affects the gastrointestinal tract where it reproduces until it induces diarrhea. Infection sites in the small intestine are more intense, while infections in the large intestine can even be asymptomatic. The time between infection and excretion usually takes 3 to 5 days. Cryptosporidiosis is not commonly a life-threatening disease in normal, otherwise healthy populations. In other groups, such as children and pregnant women, the dehydration effects may become more hazardous. Infection could lead to serious or life-threatening health effects in individuals or populations with weakened or suppressed immune systems, such as patients suffering from AIDS or those recovering from organ transplant operations. Diarrheal disease in children in the first years of life has been associated with reduced physical and cognitive development. A study of Brazilian children found that the early childhood diarrhea was associated with an average 3¼ inch reduction in height by 7 years of age. Nonverbal intelligence test scores at 2 years of age were inversely associated with the number of Cryptosporidium infections.
On August 23rd, after receiving notification from a local homeowners association of a large number of diarrheal cases within their neighborhood, an investigative team was assembled. It included the director of the local health department, epidemiologist Leslie Knope, sanitarian of the local health department, Ann Perkins, and a representative from the Texas Commission of Environmental Quality, environmentalist Juan Swanson. Resources for lab testing and control measures were funded by the state health department. The HOA informed the county health department of 5 recent clustered cases of diarrheal disease in the last 3 months, which in comparison to the population of 400 people in this rural community is a substantial number of patients with an unidentified disease. We consider the situation an outbreak. Our team surveyed a member of each residency surrounding the neighborhood within the HOA to get a better estimate of the extent of the outbreak. Also, the 2 local healthcare providers were asked to review their patient files for those who had visited their practice during a 3-month time frame and report the patients who had been seen due to symptoms of cryptosporidiosis. Verifying the presence of the parasite by laboratory diagnostic methods was possible for the 5 people with recent diarrheal symptoms that the HOA reported to us. Verification was also possible for 2 people identified with current diarrheal symptoms during the household interviews. 6 other potential cases were identified by the household interviews or physicians' records, but their diagnosis was only possible based on the combination of symptoms that they had presented with. A person was classified as a case in the investigation based on laboratory diagnostic methods if possible, or by a history of experiencing at least 3 of the 5 defined symptoms for cryptosporidiosis during a symptomatic time frame of 5 to 14 days.
Altogether, there were 11 cases identified in our investigation. 2 suspected cases of the original 13 were ruled out. The cases varied in age from 3 to 55 years old. We interviewed all 11 cases in order to determine a common exposure amongst them. In step 6, we created a hypothesis that the pool was the source of the outbreak. We used an epi curve to determine the type of source causing the outbreak. We also plotted the geographic locations of the cases to see if any pattern emerged. The majority of the cases were grouped in the neighborhood where the outbreak was suspected. To generate the hypothesis, we used the epi curve, the geographic locations, and the questions asked in Step 5. For Step 7, we wanted to confirm our hypothesis by performing a case control study. We enrolled each case and had a control from the town who was age matched within 1 year. Questions were answered about potential exposures such as swimming in pools, eating local vegetables, drinking from a community well, and changing an infant's diaper. The results of the study showed that swimming in the community pool had an odds ratio of 4.5 with a confidence interval of 3.2 to 10.1, meaning that it was statistically significant. In addition to the case control study, an environmental study was conducted. Samples of water were taken from pools and natural bodies of water around town to test for the presence of Cryptosporidium. The community pool was the only body of water that tested positive for the microorganism.
So, now that the health department knows it was crypto that was causing the outbreak, and we have every reason to believe the local swimming pool was the start of the problem, the pool was closed and quarantined, disinfected immediately, and weekly for a period of time going forward. An educational campaign addressing the dangers of swimming with diarrheal symptoms was launched, which included posters being hung by entrances to swimming sites, such as pools and natural swimming areas, and at schools, and kids were sent home with flyers to show their parents. Daycare centers were urged to enforce policies around diarrhea and swimming and promote hand washing amongst children and staff. The local radio broadcast a 20-second PSA about the dangers of swimming and diarrhea, and a press release was also provided to the local radio, TV, and newspaper outlets with all the information available about the outbreak and the response, including fact sheets on cryptosporidiosis, CDC resources, and helpful links. The health department even tweeted some helpful info. Then, as mentioned, we made over-the-top efforts to educate the stakeholders, daycare center staff, and swimming pool operators about the outbreak and how it could have been prevented. And of course, we reported the outbreak and investigation results to the CDC. Ann Perkins, the health department sanitarian, and Director Nope are personally holding random spot checks and testing water in pools, and have formed a series of work groups authorized to implement increased control measures if any further cases are identified. Area healthcare providers were also asked to test for crypto in cases that meet symptom criteria, and the county government is proactively tracking cases of crypto test results going forward.
Cryptosporidium has caused a lot of trouble for this neighborhood. So in order to prevent another outbreak from occurring, we must set a series of recommendations and goals. Fecal contamination is no laughing matter and can pose a serious health threat to those exposed. Due to the high volume of individuals that visit their local pools during the summer months, it is adamant that everyone follows these recommendations to keep everyone safe, happy, and healthy. Short-term goals should be used for when an outbreak is occurring. If there has been a sighting of fecal contamination or someone has reported it, then the pool should be immediately evacuated. Proper cleaning and sanitization chemicals should be used according to the CDC guidelines for decontamination. A report should be sent to the local health department detailing the incident and the steps being taken to resolve the matter. Then notification letters should be sent to the families that were exposed to the pool and have risk for developing symptoms. These would include info on how crypto can spread throughout a community and what symptoms to look out for. All other pools within a 30-mile radius should be monitored for 30 days for any signs of Cryptosporidium. Long-term goals will set a foundation for the prevention of any future outbreaks of this troublesome bug. The first goal would be to establish a water safety plan. It would include an inventory of all community and private swimming pools within the area. Next, a sign-in sheet should be made at all pools to record all patrons that come to swim. This would allow a way to contact the families in case of contamination. Next on the plan would be a risk assessment of all the community swimming pools. This will show any weak points at the facility that could stand to be improved. The plan will also contain detailed instructions for CDC recommended pool cleaning procedures in case of contamination. Next, informational literature such as letters, posters, and handouts will be used to spread the word on water safety and the best pool maintenance practices. Then, there will be guidelines for the regular and systematic testing for any fecal contamination of community swimming pools, as well as the water supply used to maintain the water level. Finally, there will be a procedure laid out that will show how to report the pool test results and who to send them to. The next goal would be to establish an anonymous reporting system for patrons to use when they suspect fecal matter in the pool facility. This relieves any pressure of the patron being identified or feeling embarrassed to call in. This will also greatly assist the pool staff, as more sets of eyes are always helpful. Next goal would be to develop a media campaign that focuses on water safety. This plan would include literature on proper hygiene practices as they relate to the use of recreational water facilities. Next, signs would be made and posted around community pools with information on proper water safety. Finally, this plan would include a social media and/or local television spot to disseminate the information. These campaigns should be focused during the summer months when swim season is at its peak. The last goal would be to establish a formal relationship between the local health department and the Parks and Recreational Department. A chain of command would be established in the event of an outbreak and requirements for reporting to the proper channels. If all these guidelines and recommendations are followed, the chances of a future outbreak of Cryptosporidium are greatly reduced. Stay cool in the pool, but be safe and smart.